And if you think back to a year ago when everybody was here for that first day and that first ceremony, who would have imagined what kind of year that we had? And we made it through hurricanes, storms, reschedulings, but we are here, and look up because this is a beautiful day. So please give yourselves this tremendous round of applause. This is such a special, special, special day. My name is Rebecca Stewart. I'm so thrilled to be here today. We're here for a very special ground opening. You all know that, but this is truly what we have been talking about, is this celebration of access. It is a celebration of the community. It is a celebration of you, our remarkable experts. And as I looked around and I was chatting with Keith Graham, healthcare has never, ever, ever been more important than it is in this moment. And that is why this is more important than it ever could have been, than we ever truly imagined. And we're here because we believe in healthcare. We believe in community. We believe in this vision that we talk about over and over because it's real and it's heartfelt, to be most trusted for personalized coordinated care. Those aren't just words. It really means something to everyone who's here. So we are a part of the community. We are moving the community forward, and we're moving healthcare forward. So look around, be incredibly proud. That is why we're here. We're very excited to be here. It's my great pleasure to introduce our Executive Vice President and Chief Strategy Officer, David Whitehead.
Thank you, Rebecca, and good afternoon to everyone. This is a very special day, not quite the celebration we had imagined a year ago, but clearly we are so grateful that you are all here today. Rebecca just touched on what I think is the critical theme about what we're trying to do as Hartford HealthCare as we look out over all of Connecticut, and especially here in the southeastern Connecticut area, is really bringing more access into the community so that folks have the ability to get to our clinical expertise. And a number of our clinical experts are here today, and I couldn't be more thankful for what you're doing in this community to support all of southeastern Connecticut through this tremendous facility. And this facility itself really deserves some thanks to a number of people who made this all possible. First, David Latazori, who is not only a very good friend of Hartford HealthCare, but our partner in this process, and really had the vision for Perkins Farm to create this campus. And if any of you thought you'd have the opportunity to maybe live next door, he just told me he's at 100% capacity. So we're going to try to convince him to build more, because this is a tremendous community to live, work, and play in. I have the good fortune of being close by and spending a number of my days in this community. To Bill Hardy and Hale Chait from FIP, this is your work. You did this. You pulled it together. You took a vision that we had to really try to bring forward and replicate the history and the traditions and the spirit of Mystic Connecticut, and you certainly did that through this building. Bob Goodwin at Perkins & Will, who listened to some of us over and over again about what that design process and what we were looking to do here. We couldn't thank you enough. And then to Jen Murnane and Martha Santilli, all you have to do is walk inside this building or look at the patio furniture, which I've already inquired about. Just a tremendous effort to bring the Hartford HealthCare brand to life here in this facility, and one that I know the team will continue to replicate. And then to my partner in all of this work, Karen Glayette, who's our Senior Vice President for Strategy and System Integration, who has to put up with some of my crazy ideas from time to time and keeps me grounded in this work. Karen really put her heart and soul into this entire project to make it come together, and most importantly found the dollars to invest so that we could make this happen. So Karen, thank you so much. Additionally, I think it's important to recognize the services that are being provided here today. And I underscore today because we are Hartford HealthCare, and we continue to look for ways to bring more and more clinical services and clinical expertise into this communities and in all communities across Connecticut. But primary care, imaging, rehab, institutes, Heart and Vascular Institute, the Neuroscience Institute, with our spine movement disorders and headache programs. And then, right now, community education is a core component of what we try to do within this community and communities throughout Connecticut. They're all virtual, obviously, but at some point in time, we hope to be able to use this facility to bring people into this location so that they can participate in those classes. And there will be more to come at this campus and within this facility, and we are talking to David about some future plans that we have for this location. Again, I would just continue to underscore Hartford HealthCare's commitment to the community, to the state of Connecticut. And these investments that we're making really are about providing more life in your life and helping people live their healthiest life based on where they are in their life cycle. And clearly that's demonstrated here in this facility with the services that are offered and the expertise that we're bringing into the community. So to all of you, to the team, to our partners in this, thank you so very much. It's a very proud day for Hartford HealthCare, very proud day for the folks who had the vision to make this happen 10 years ago. And I know that under Donna Hanley's leadership as a president of the East Region, we'll continue to expand and grow everything that's offered here. So thank you very much.
Thank you, Dave. Now, what we really wanted to make sure as we look forward and we think about what is to come, one of the sources of pride throughout our system has been this remarkable Senior Director of Infection Prevention. As we take a look at why we're here, I would like to invite him up to talk about the role that each of us has and what we can expect going forward, because we are all a part of dealing with this pandemic. So Keith.
Awesome, thanks Rebecca. So, whenever I come to these things, I've said to Rebecca a few times, I'm probably going to start trying to go earlier because, one of the first speakers, because the cool things have already been said. Right? So, beautiful building, okay, so I could take that off, right? The need for us to maintain vigilance with this pandemic is definitely important. I think one of the things, when I came over to Hartford HealthCare, which was not that long ago, we just spoke about that. I feel like I came over and the pandemic came. I didn't bring the pandemic, but it followed me over. And one of the things we spoke about is the fact that there's communities that are lacking access to care, and with lacking access to care lead to certain comorbidities, and hence increases your risk and the mortality rate within those communities for any exposure to any disease, to include COVID-19. And this is an example of the commitment from Hartford HealthCare to address that. And that's huge. I'm exceptionally proud of that process. I'm exceptionally proud of that thought process and the constant integration and consideration of the needs of the community and the need to expand access. In regards to, as you said before, our need to be vigilant. So we've seen over the last few weeks across the state a number of what I would say slight pockets of uptick. And when you do deep dives and we communicate with other healthcare facilities, what we see is that there's some lapse in concentration, right? So the message is keep on. There's a reason why Connecticut is top in what we've done with this pandemic. We need to keep doing this. And there's some things that we saw, which was obviously communities that were challenged, and this is a big step forward to giving more access to care. And I'm looking forward to working with Donna and her team to ensure that quality care from infection prevention is exemplified within this institution. Thanks, guys.
Thank you so much. And you heard Dave speak a little bit about Mr. Dave Latazori, so we are so excited to have you come on up and share a few words. We're so glad you're here.
Thank you all for having me today. This has really been a 20-year journey, really 2 generations in the making, and it started when my father purchased this property from the Perkins family over 20 years ago. And it really has been a dream come true that I found tremendous partners in Hartford HealthCare, in particular David Whitehead, Karen Goyette, Donna Hanley, and their entire team at Hartford HealthCare. It really takes true visionaries to see a project like this off. And what you see here is a vision for 21st century medical care into the future. And Rob Goodwin at Perkins & Will has done an absolutely unbelievable job developing a building that is really state-of-the-art. And although we may be a small town, Mystic, I feel, based off my travels, is known all over the world. I really can't say I've been all over the world, thousands and thousands of miles away. And when I mention Mystic, a smile lights up on someone's face. And they go, I spent this amazing day there. Most people don't know that Mystic has been on the cutting edge of many different fronts for centuries. In fact, we were the first town that designed America's whaling ships that are stationed down at the Mystic Seaport. And now we're all known for marine sciences headquartered at the Mystic Aquarium across the street. But now under the leadership of Hartford HealthCare, they'll be known as a Center for Excellence in Medical Care in this region. And when you look at this building, right, it's how we imagine 21st century medical care. When you look at the front of this building, especially from I-95, it's curved, so it actually looks like the shape of a hull, of a skiff. And then on the corner is a beacon, right, which is a modern interpretation of a lighthouse, standing strong against the shoreline. Now, a building is really just a building. It's the doctors, it's the nurses, it's the skilled staff that really make it what it is, a beacon for quality medical care. And this beacon is not just symbolic, it's symbolic and important to me because it actually reminds me of my dad. And the last time we were here, I said a couple words about him. My dad was my hero. And when I was 21, I gave up everything to come back and help take care of him when he was ill. And one of his dreams was to see this project through. Now, my dad grew up as a poor farmer, actually, and outside of the Hartford area to poor Italian immigrants. And he had it pretty bad, as he always reminded me every day whenever I wanted anything. He's so bad, he said, sometimes we didn't even have enough money to put food on the table. So I go, what would you eat? He goes, well, we'd have to trap stuff because there wasn't enough deer around. I go, well, what would you trap? He goes, well, we trap squirrel and chipmunk. And me as some, punk kid is going, well, what does chipmunk taste like? And he goes, well, it kind of tastes like woodchuck. So anyways, I can't verify if that's true or not, but what I can verify is that my dad's dream was to save up enough money and move to the shoreline. And even though he was a farmer, he always heard the call of the ocean, and his dream was to move to his dream town, which was Mystic. And he actually built his dream house, which was a lighthouse. Our house is designed after the Stonington Lighthouse down the road. And for me, when I think of this building and when I think of that beacon, right, a lighthouse is important because it's symbolic to all those who pass by that safe waters are near. And this beacon here is really, really a triumph to this community that Hartford HealthCare has chosen it as a destination for quality medical care. As my dad used to always remind me, lighthouses don't go around the seas trying to find boats to save. They just stand there shining. So I'd like to thank Hartford HealthCare and everyone here for making one of my dad's biggest dreams a reality. And that lighthouse right here will serve to all those that pass by for generations to come. That when this community called for quality healthcare, Hartford HealthCare was there. So I hope you all are pleased with the final results, and thank you for helping make a dream come true. Appreciate it.
Dave, you gave me chills. What a special, special, special story. So thank you for sharing that with all of us. It is my great pleasure to introduce Donna Hanley, who is president of the East Region and a beacon in her own right.
Well, thank you for those beautiful words, Rebecca. So, Keith, you wanted to not have to go too far in the agenda. Try following Dave Lattizori. And really, I am not only humbled by your story, but your vision and your father's vision and the vision of Hartford HealthCare are so aligned. And I feel this great sense of responsibility and great excitement to bring that not only to fruition, but to continue to grow that. In Hartford HealthCare, before I start, we have a tradition of starting every meeting with a patient's story. And I would like to start Becky Durham, who is our Senior Director for the Neuroscience Institute in the East Region, and I were chatting today, and she had a patient, Robert, who gave permission for us to tell his story. And it really is just symbolic of the care that's going to be delivered not only here in this building, within the East Region and within Hartford HealthCare. So Robert was a patient of Adrian Hamburger, who's one of our pain specialists here in the building. And he continued to have challenges and difficulties. And so Dr. Hamburger referred him to our new headache specialist, Dr. Catherley, who also happens to see patients in this building. And then he needed an MRI, and he was able to have it here. And he needed a procedure and was sent to Bacchus. I'm looking at all my colleagues here. And based on a procedure, he needed to see a neurosurgeon. And he have a new neurosurgeon, Mark Horniak, here in this building. This was a patient who was going to go to Boston for his care. Instead, because of the way in which we coordinate care and the way that our institutes are organized to bring all of the specialists in a certain disease and care for patients in one place, Robert is receiving his care here in his community, in this building. And so what I want to do is start by thanking the amazing clinicians. I want to recognize Dr. Haronian, who is our Vice President of the Heart and Vascular Institute. Mark Alberts, I want to reach out to you as our Physician-in-Chief of the Neuroscience Institute. Dave Whitehead mentioned, this building really is focused on Heart and Vascular Institute, Neuroscience Institute, primary care, which is really the portal of entry for our patients, and an amazing imaging service. So I couldn't be more thankful to the community. The community has welcomed us, and it really allows us to continue to build relationships. We'll continue to make connections between our primary care physicians, our specialists, and coordinate care for our patients. So I want to thank you for the very warm welcome the community has given us. And I take that responsibility of continuing your father's vision and the commitment that we within Hartford HealthCare have made to the community and to our patients. So thank you for being here, and I look forward to working with you.
I love this idea, this vision of Hartford HealthCare as a beacon, and it is the world-class expertise, the world-class experts, world-class care right here in your town, which is what you just described. And Dr. Haronian is going to come up and speak a few words just to make sure that we do recognize and remember our world-class experts. So thank you.
Thank you and welcome everyone.
You're batting cleanup, Howie.
I shouldn't have touched it. COVID. Isn't it just great that we're having a celebration? I mean, when I got the invitation at first, I thought, gee, are they going to do virtual ribbon cutting? We've gotten into such a mentality of COVID. In 6 months, I can't remember actually getting out to celebrate where there are drinks and more than 20 people. So congratulations to all of you for just making it to a real celebration. And what a great reason to have a celebration. I mean, this building, I'm one of the lucky and humbled to be able to work here. I think that's why I'd like to represent the doctors who are lucky enough to work for Hartford HealthCare and all of our advanced practitioners, nurses, and staff. The Heart and Vascular Institute, when we did the beam signing here, it seemed like just yesterday. Since then, we've recruited and started and onboarded 9 cardiovascular physicians just in the East region. So we're already busting here. This provides a great professional, clean, state-of-the-art home for these professionals who we were lucky enough to recruit. So I think it is more than a building, David. It's a beacon for us to recruit and to maintain the high level of care that we've all come to expect from Hartford HealthCare. So with that said, I would just mention a couple of little plugs for Heart and Vascular Institute here. This building is our shoreline hub. It is intended from design to provide a very strategic location here on the shoreline that can essentially provide all heart and vascular care outside of an inpatient bed. We can do advanced testing with our partners at MRA, and I see you back there. We are developing advanced cardiac imaging. We have the fastest, strongest 3T magnet in the system right here in this building. We have the first solid state SPECT nuclear camera that image is the heart. Any of you who have had a stress test in the past may remember getting imaged. It takes 20 minutes, half an hour. You got to come back for another scan. This scanner can do it in 5 minutes. My partners up at Hartford are jealous of the equipment here and of the facility here. So I just want to take the time to thank all of you who provide all of this for people like me who work here and take care of our patients in the community. We really couldn't do it without all of you, from the vision to the completion of such a state-of-the-art facility. It makes my job a pleasure, and I know I'm speaking on behalf of all of our physicians, advanced practitioners, nurses, and staff. It really shows that Hartford isn't just surviving through COVID, but we're thriving. It's a real testament to the fact that Hartford is moving and growing despite some headwinds that we're all facing. So thank you for coming out and at least giving me a real celebration with friends and family and people for a change. And enjoy the rest of the evening.
Thank you so much. And what we want to do now, and I know that Dave is getting ready for he's going to be live on WFSB, so we have to make this speedy. We're going to head on over and do our ribbon cutting. Thank you so very, very much for being here. Staying safe. Be safe, everyone.
Don't really cut the ribbon yet. What do you want? Don't really cut it yet. We gotta make sure we got the picture first, please. All right. That's Stewart. Karen. I'll hold your purse.
All right, I think I can see. I'm going to have you kind of creep up just a little bit.
Yeah.
Now they call it, I know you can't smile, I can't see your smile, but I heard a new word, it's called smizing. You smile with your eyes. Don't cut yet. Everybody looking here, that's good. Another one like that, good. Couple more, good. Looking up here, aerial shot. A little camera here. Dave knows me quite well. So. This looks good, all right. You guys ready? I'm going to do cutting here, so hang on a second. On 3. 1, 2, 3. Hey.